And then while I'm doing that, I'm going to be doing a brief introduction to treatment goals. Whether the goal is a curative, and I'll be explaining what these are, whether it's a curative plan, whether it is what is called a palliative plan, or whether it is a preventative plan. All right, it's very important. So I'll be going into that this evening. What is a curative plan, a palliative plan? Because a lot of times, we don't want to admit it. We don't want to deal with it. Some people, depending on their age, depending on how severe their cancer is, unless you know of a miracle, the approach that you have may not be curative. All right? It may not be curative. And a lot of times people don't want to hear this. But there are times, depending on the age of the person and the severity, how severe the cancer is, sometimes what you have to have is what is called a palliative. How do you help persons by reducing the symptoms and reducing some of the painful experiences that persons have? How do you prepare a person's mind mentally for what is inevitable? That also is an option. And as I said, I know a lot of people are not real, and a lot of people don't want to hear that. A lot of people don't like to hear that, but it is an option, because once you are diagnosed with cancer, you have to admit that one of the options is death. But then it's not the fact that you're going to die or the person is going to die, it's how is that person going to die? You know, how is that person? So it may be possible for the person to travel in that direction in a way that is painful, and there are options. There are literally options. So that has to be one of the options that you have to plan and prepare for once somebody has cancer. So we're going into that this evening. We're going to be going also into the importance of individualized care. What is individualized care, and the importance of individualized care? And we're going to be looking at the different types of, as a treatment plan. And so when we look at a different treatment plan, we'll look at each of them and give some more explanation. And then next week, we'll be looking at understanding your diagnosis and prognosis. Again, the goal is not to replace your healthcare provider. A lot of the times people think that these sessions are to empower persons to replace their healthcare provider. That is not the goal. The goal is to equip you and educate you, so that you too can be a part of that team. Because a lot of times people are sick, and because of how ignorant they are not included in the healthcare program. They are not healthcare, that is the cancer recovery program. They are not included because they are simply not knowledgeable enough. As I said, so many times persons have a lot of misconceptions, and it would take so much time to clear up the misconception that sometimes it's easier for the healthcare professional to leave you out. I'm going to talk about this a little bit. Sometimes it's easier for the healthcare professional to leave you out. Now, sometimes there are some healthcare professionals who don't value your views, who don't value your opinion, and so they don't respect your belief. And so sometimes what you say, what you think, or what you believe is not important. But this does not represent every healthcare professional. All right? And so what I think is a challenge is that a lot of healthcare professionals don't have the time to really go into explaining what's happening to you or your loved ones. All right, because and then some of them are not skillful enough, because they have all of these complex terms, all of these difficult phrases and jargons, and some of them don't know that they're not talking to a medical person. They're talking to a simple guy on the street corner. You're talking to a grassroots persons, and so not everybody has the ability to convey information skillful and effective enough that persons can understand, especially if persons are from the grassroots. All right, and so a lot of times, because they don't, people are not equipped and they are not knowledgeable, and there's so much ignorance, and these healthcare professionals don't have the time. What usually happens is that how you are going to be treated, what you are going to be take, be taking is usually discussed and decided with everybody else except you or except a member of your family. And so the dangers of that is that a lot of persons who their family members don't know why they are doing this, or they themselves don't know why, what we find a lot of the times is that there is a breakdown, there is an inconsistency in people being compliant with what is required of them to do. And so it's very important that people become knowledgeable. It's very important that people become informed. You know, if I were to go on now and just to be talking about this herb that is good for that, and funny enough, people want to blame somebody. People want to be irresponsible, and there are a lot of irresponsible persons out there who just come on a screen like this and they'll tell you that this herb is good for that, that herb is good for that, this herb is good for that, that herb is good for that. Most times, that is an ignorant person just giving information. Now, it doesn't mean that what they're saying is not true necessarily. It's just that what was true for somebody in a particular instance or who has a particular cancer may not be necessarily true for you. And so there's a lot more that goes into fighting cancer than what herbs or what natural therapies options are out there. There's a lot of knowledge that is necessary for you to help you to decode and to help you to decipher what works and differentiating what may possibly work for you. So this workshop is really designed to equip persons to be in the know. So you can identify when somebody is being irresponsible or being ignorant by just listing plants that can work, that possibly can work, that have been proven to work. Because a lot of times people take information and they use it and it doesn't work and they say the information is no good. It's not necessarily that the information is no good or it's not true. It's just that there are other factors that you didn't consider. There are other factors that made it not work for you. All right? And so it's very important for persons to know. It's very important for persons to be in the know. And so that is the reason why we're doing this workshop. A lot of persons, even though I'm doing this workshop, a lot of persons will still call. And there's nothing wrong with that because the goal is really to help you guys. But if you have not yet watched our first video, we did a video just recently where we talk about understanding cancer families. And I said, that alone is really an eye-opener. You should go and watch it if you haven't watched it, because it actually talks about the different types of cancer, because a lot of persons are under the notion or they're under the misconception that there is only one type of cancer. Right? So cancer is actually a group of disease. Right? And we don't know which member of the group you have. Right? So cancers belong to families, and those families groups are determined based on how cancers behave, function, and how they manifest themselves. So before you can fight it, the first thing you need to do is to understand it. Right? The first thing you need to do is to understand it. And one of my goals is really to clear up a lot of the possibilities that are out there for persons to be deceived and persons to be tricked. All right? This evening, we're going to be talking about, and I've alluded to it in my last video, where I talk about how you know a good cancer intervention program. We're going to be giving a spreadsheet, a document that persons can use. We're going to be going through that this evening. What are the criteria to look for? Right? If you go to your oncologist, if you go to your doctor, or the minute you hear that you have cancer, in our first video, we talk about the 3 questions that you need to ask. One of them is, which family does this cancer belong to? Because you want to know what you're dealing with. And that now is what's going to determine whether a particular herb is effective for you. How carcinomas, which is a type of cancer, behave is different from how leukemia behaves. So what will work for carcinomas, which is one family of cancers, what will work for sarcomas will not necessarily work for leukemia. because there are different families of cancers and they work and behave differently. And then there's also the fact that some cancers is a crossbreed between more than one cancer families. And so this brings us to another point. A lot of persons don't trust medical doctors, and so because they don't trust medical doctors, they don't take advantage of the knowledge and the tools that modern science has that helps us in being more effective in our approach. So we're talking about doing ultrasounds. We're talking about doing x-rays. We're talking about doing CTs. We're talking about doing MRIs. A lot of persons are not are afraid. Some persons will tell you upfront that I don't want to know what I have. If I have it, I don't want to know. And that is also one of the misconceptions where a lot of persons find out too late. And when they find out, at the stage at which they find out, they want a miracle to be done overnight. No, and again, what can happen when you're at stage 1 is very different from what can happen when you're at stage 4. And so what you want to know is you want to know as early as it's possible. Because when it may be possible for you to use a natural approach and get results in stage 1, it may not be as possible for you to use that same approach and get the result if you have stage 4. When you didn't have to use a therapy that you didn't want at stage 1, you may be forced to use it at stage 4. So there's a number of dynamics that can happen, and that we want to educate you so that you can have that knowledge, so that when you are talking to your healthcare provider, you can actually ask questions that make sense. You can actually ask questions because the job of your healthcare provider as a professional is to provide you with information that further helps you in making the right decision or the right option for you. And so it's very important that persons, and I can't overemphasize it enough.